We're back in part 2 now with Dr. Nicole, oncologist, hematologist, talking about breast cancer. You can find the different parts of this podcast here, and you will learn about this amazing woman, professional, embracing her life to cure people of breast cancer, make a difference in women and men. We'll see if men also get breast cancer. And now we're in part 2 when people are diagnosed. First of all, thank you for being here. Thank you for your patience. Dr. Nicole, can men get breast cancer? And if so, what can they do to prevent it? Do they have to take a mammogram too, like women every year?
So men can get breast cancer, but it's incredibly rare. If you have a man with breast cancer, you want to genetic test them because a significant part of the time they might have that BRCA gene. There's BRCA1 and 2. So they should definitely be genetic tested because they're a man with a BRCA gene is about 100% times the risk of the general population. So you have to think of that. But men can get breast cancer even without a genetic predisposition. Mammograms in men, we don't do them routinely. And even men who have the BRCA gene, mammogram screening has always been a little controversial. The guidelines tend to change from year to year. So if I've got a man with a BRCA gene that we're screening for breast cancer, I'll at least do a baseline mammogram, just so I, know what things look like. And then if they're feeling something, I can at least have an image for comparison. But, it's easier to just examine the chest wall of a man. There's just less tissue there usually. So any man who ever feels a lump on their chest should not ignore it. It could be a breast cancer. There's other stuff it could be too. It could be a sarcoma or something else. Also, on your testicles, don't ignore them there. Men love to ignore testicular masses as well. So just don't ignore it if you feel something.
Yeah,
another thing to watch for would be nipple discharge too, like bloody nipple discharge or any type of anything coming out of the nipple. That can often be kind of a red flag that something's going on.
Anything unusual? Just go and check. Yeah. Have it checked.
Yes.
Tell us, what is genetic testing and should we do it? What does it mean? You talked a little bit about it earlier. Does it mean that if we find something genetically, we need to do something like Angelina Jolie did? Or is it just like something that's for like on your top of your head waiting for it to fall? Or should we ignore it?
Well, so historically, genetic testing was done through genetic counselors who have a specific expertise, like they do a master's program in genetics. It's a really personal decision if you want to do genetic testing. Some things to keep in mind. If you're going to get genetic testing and you've never had a cancer, you're doing it to be proactive and preventive. Before you get genetic testing, you want to get all the life and disability insurance you're ever going to want in your life. Because if they find a gene, like let's say you are come positive for a BRCA gene, it's going to be hard to get those things once you know that, because you have to report that information.
Good point.
Yeah. So if you already have cancer, genetic testing's not as big of a deal because you can't get life and disability insurance with a cancer diagnosis anyway. But like what'll sometimes happen, I'll have a woman, she gets breast or ovarian cancer. We test her, we find a BRCA gene. She wants to very understandably test her daughters. I counsel them, make sure you get all that other stuff in order first before you find the information out. So in BRCA genes specifically, there are recommendations for enhanced breast cancer screening. So you add breast MRI to mammograms every 6 months, you alternate. And then the ovarian cancer risk with BRCA genes is the thing to understand about ovaries is there's no screening for ovarian cancer that works. You can ultrasound, blood tests. There's no screening that is good enough to catch it early. So usually around the ages of 35 to 40, we recommend prophylactically removing the ovaries.
Wow.
So when we do these prophylactic surgeries, or even if we consider a prophylactic bilateral mastectomy, removing the breasts before they get cancer, we have to have a cute name for everything. So we call them previvors. They just never got the cancer because we intervened. So, and BRCA is just one gene. We know about a lot of different breast cancer genes. We know about colon cancer genes. So one of my roles at my job is medical director for genetics. So the genetic counselors kind of work under me and order all the tests under my name. And when we have positive patients, then I medically manage the things they need for prevention and screening. So do I think it's awesome? Yes, I do. But you make a good point that some people look at it as, I don't want this hanging over my head. I don't want to know. And I try to give them pushback to say, but there are things we can do to prevent, or like we found out because your mother died of ovarian cancer and her death is not in vain if it helps you. We found this. So I think it has a lot of value, but There's a reason they're genetic counselors, because there's a lot of like guilt for family members who are positive and pass it on to their children. They feel responsible for it, and the anxiety that it can cause knowing that you have it, even if you may never get a cancer diagnosis, it's not a guarantee. So it's a very emotional thing. I agree.
And what is the percentage that you might get it if you had that in both breast
It
and ovarian?
depends on the gene specifically. In BRCA genes, it can be up to like 70% chance lifetime for breast cancer, and depending on which BRCA, somewhere between 20 and 40% for ovarian cancer. There's also pancreatic cancer risk, melanoma risk, prostate cancer risk. So sometimes men don't think they need to get tested for a gene for hereditary breast and ovarian cancer, but there's a prostate cancer risk. Doing it before you would get tested, I think a very thorough informed consent process, deciding how many genes do you want to do. Like, you can do a more focused panel based on your family history. There are like 80 gene panels through some of the companies now, because what happened around the like early 2000s, around like 2011, 2012, the technology got better. So it costs the same to test one gene as it does to test 80, because of these next generation sequencing machines. So you can do a ton of genes, and what might happen is you find some obscure gene with no guidelines, and we don't know what to do with it. So I think you need to be counseled of like, how many genes do you really want to test? What might we find? Another thing that can be found is something called a variant, where we're watching it, but it hasn't gotten classified as something that causes disease, could get reclassified in the future. So there's a lot of different things you can find. And I would recommend, if you're going to do it with the like pre-informed guidance of a genetic counselor.
And is this covered by insurance?
Yes. Mostly. So if you have there's something called the National Comprehensive Center Network guidelines, NCCN guidelines. So they have testing guidelines. So if you meet the NCCN guidelines, usually insurance will cover it. If you want to get tested and you don't meet guidelines, a lot of the companies, so there was something really important that happened, I want to say early 2000s. It was a Supreme Court decision that, because there was a company named Myriad who wanted to patent the BRCA gene. Like, they were the first to like sequence it and make it commercially available, and they wanted to patent it. So the question was, can you patent something that already existed in nature? And the Supreme Court decision was that they could not. So what that allowed for was multiple genetic testing companies to compete with one another. And that competition was good, because now genetic testing companies know that if they charge you $5,000 for a genetic test, they're not going to get any business. So a lot of times, if you don't meet criteria, a lot of the companies will say you can do as many genes as you want, and max out of pocket will be $200. And then there's these commercially available products like 23andMe, which has subsequently been shut down. And I think even with Ancestry, you get some of this stuff. But those labs are not CLIA certified labs. I forget what the acronym stands for, but it's like the people who regulate that your lab is giving accurate information. So if you would ever test positive in one of those like swab kits that you get from a company, really what you want to do is have it retested through a certified lab. And I would just like take the result to a genetic counselor and make sure they test you in a reputable lab to make sure that that's true.
Do you recommend it?
I mean, I do. Like, I'll give you, this is like a genetic counselor's nerdy story, but this is like what makes our days. I had a patient who had stage 3 colon cancer. And she got genetic tested and was found to have Lynch syndrome. So Lynch syndrome is a hereditary colon cancer syndrome, but it's also risk of ovarian and uterine cancer in some of the genes as well. And she had a prophylactic hysterectomy, ovaries and uterus removed, and she had a stage 1 endometrial. So like, isn't it stupid to cure one cancer and know about it, like not find out about the gene and then let another cancer kill you? So like that was a win. We prevented her dying of another cancer, which is not as easy to detect early. So that in itself is a good reason to do it.
At what age do you think it's a good age to do it?
Well, it depends on the gene. So BRCA, I do not test anybody under the age of 18. It's a good time to get tested, because you want to get tested when you actually do something with the information, like when screening recommendations start. So, I've had breast cancer patients who tested positive for BRCA and very emotionally convinced their pediatrician to test their like 7-year-old daughter. And that kid's saddled with that information for the rest of their life. Like, they might not be able to get life insurance or disability insurance. And we don't even really start doing any breast imaging until the age of 25. So the best time to test for the gene you're testing for is when you'd actually do something with the information. Now, flip side, some of the colon cancer genes, you start screening in childhood. You can see cancers and like various cancers at young ages. So it makes sense to test a kid because you do something with it.
Yeah. Okay, so that's clear. But first, have all your insurance and all your requirements, right? Your paperwork done. Now, let's go to breast cancer. You're diagnosed. What to do? Your world just falls apart. You just think this is the end. I know it happened to me, right? And it's very emotional because you really think it's the end. You don't think of anything else. You are completely frozen. How do you approach this as a doctor, as a woman? I know that as a doctor, you said you just like put your barriers, and you just focus, right? What are the do's and don'ts? Suddenly, because it happened to me, I froze. I only thought I'm not going to be here for my daughter. Who is going to take care of her? Who should I mean, you're preparing your funeral the moment they say that. I don't know if I'm exaggerating or somebody, but thank God I had a friend with me because otherwise she heard everything. I'm sorry, she recorded everything, although she shouldn't have, but she recorded it for me. I won't say anything else. And you think about other approaches like holistic, and then you start asking other people, and different people have different treatments, right? Because now you can tell us how many kinds of breast cancer there are. You're always thinking, oh, I only have radiation, or I only have surgery, or because that person told me they only had that. And suddenly that happened to me is like, no. You're going to have all the treatments. What? You're going to have chemo, then you're dead. When they say the word chemo, you're going to die tomorrow. Then it's like a surgery, forget it, right? And then it's like you're going to have radiation, more, everything. So what happens? You're diagnosed and you're frozen.
I'll tell you what, it's almost like we'd need 10 podcast episodes for me to tell you all the subtleties of this. But the big picture is, you do the biopsy, it looks like, look under the microscope, it looks like a screwed up cell that started in the breast. Okay, it's breast cancer, but we test for receptors. So we test for estrogen receptors, progesterone receptors, and HER2. And these are just proteins on the surface of cells that get stimulated by estrogen or various other proteins to tell the breast cancer cells to grow. So when I say breast cancer, it's in the curative setting, it's 4 different diseases. So I'll say it slowly. It's estrogen positive, HER2 negative, estrogen negative, HER2 negative, or triple negative, estrogen positive, HER2 positive, triple positive, or estrogen negative, HER2 positive. So those are 4 different things. And I'm trying to answer your question of what do I do first? Some of those, surgery is first. Some of those, they need chemo, and we give the chemo first. Because especially the more aggressive subtypes, we give chemo first to try to shrink it and then do the surgery. And you can actually look at that tissue and see if all the cells go away. And if at the time of surgery in that specimen, there's residual cells, we actually make alterations to our treatment afterwards. So we make decisions on that information. So most of the time, you're either going to go to surgery first or chemo first. So you'll either meet with a surgeon or a medical oncologist. And a lot of where I work, we have something called breast cancer nurse navigators. So they're the people who kind of help you at the beginning to deal with the emotional aspects of it and try to tell you what's next. So in a good health system, you shouldn't have to figure out what's next. Usually there's a navigator there to call you or meet with you at the, where they do the biopsy and say, this is what next, because they're nurses who have training and can kind of guide you to the next right step.
Okay, so then it's sometimes you decide to go for a second opinion. That happens commonly, maybe?
Yeah, pretty common.
What happens if the second opinion is completely different from the first opinion? What do you do? In my case, the second opinion told me I had to have surgery and they were going to deform my breast. The first one was like, no, we will do chemo first, right? At the end, I didn't know what to do, but I just decided to go with my gut feeling. You have to put your trust in somebody.
Right.
Right? That was my experience. What is your advice as a doctor?
Well, I think you have to understand, and this is very hard for engineers. And engineers, their lives are zeros and ones. It's black and white. Medicine is not black and white. So there are situations in breast cancer. Let's say you have a tiny early stage estrogen positive, HER2 negative breast cancer. You can get 10-second opinions. Everyone's going to say do surgery first. But there are those situations that are more controversial. Some of the very small aggressive ones, our guidelines still say do surgery first, but I personally like to do chemo first because I know they're going to need it either way. And I like to get that snapshot at surgery of what the response was. It informs me. So there are, in any disease, you're going to have controversial situations where you may get a different second opinion. And I think that's the risk of getting a second opinion, is it really can be upsetting when doctors don't agree with each other. But you're 100% correct, Christina, that at some point you have to decide, which doctor did I have a rapport with? Who am I going to trust? And you got to make a decision. So sometimes second opinions add to your calm because everybody agrees. Sometimes they don't, because it may be a controversial, and your doctor may even need help. Like, there have been times where I'm seeing something I've never seen before. There's rare things in oncology like sarcomas and other stuff. And I'll just flat out tell the patient, I've never seen this before. I'm happy to treat you here and keep you local, but I need help. And I'll send down to Philly and I'll help them find the right person. So, and any doctor who is threatened by your request for a second opinion, you should run the other way, because I'm not afraid to have my work checked, and I'm not afraid to have the input of my colleagues and have a collegial discussion with my colleagues at, in Philadelphia or wherever.
And you're saying then with the different kinds, 4 different kinds of breast cancer, the treatments are different for each of them, right? So you cannot say, this person I know had breast and they only had radiation. Oh, they only had, because then I had it all. So it didn't work. I had the whole full service a la carte, the menu. Can you
and that's like,
say, I have this. No, I don't want to do the surgery. No, I'll do the radiation. It happens. I mean, I fought in every step of the way. My doctor knows that.
I mean, it's, everything's always your choice. I mean, I sometimes I've noticed, like, especially my younger patients, when I tell them they have to have chemo, their first reaction is, no, I'm not doing it.
Of course, right.
So I don't react to that, because any normal human, when they are told they need chemo, are like, I'm not doing that. That's a normal response. So I try to like let that reaction pass, because some people, if you get too adversarial with them, they're going to dig their heels in and then they're really not doing it. So I try to just like back up, establish rapport. Let's talk about your medical history. I try to educate them. But if there's one thing I have learned being a doctor, is that you can't protect an adult who is competent to make their own decisions from their bad decisions. And there are times when people decide to forego one of the recommended treatment modalities and they compromise their chance of cure, or they make their chance of relapse high.
I'll tell you a story, because I had signs of the universe when I was going through all of that. My husband, Robert, he was going through open heart surgery at the same time. And we have a young child. So it was, okay, thank you. You threw everything on me right at the same time. So once the nurse that was before his surgeon, his cardiologist came, the nurse was there in the office. And I said, I don't know, I have so much going on. They just diagnosed me with breast cancer. I don't know what to do. She stopped everything, stopped it, looked at me, and she said, you are going to do everything you are told to do, every single thing. I was, what? She was, yes, because I had it twice. And I had a double mastectomy, and then 6 years later, it appeared on the same spot. I don't know if she had chemo or didn't have it, just surgery maybe, and it appeared on the same spot, even with a mastectomy. She's alive, is well, but she said she had a meltdown there in the office when she read my chart, right? She said, do everything they tell you what to do. The second thing is, when my husband was being prepped for surgery, the nurse was putting him, he was chatty, He said he had worked in Sloan Kettering for 20 years, the cancer center guys, were one of the biggest ones in New York, right? In New York City.
Yep.
And I pulled him apart just before the surgery. And I said, you know what? I'm going through this. I don't know what to do. They tell me I have to do this. I'm not sure about anything. He says, look, and I've never forgot it. I've worked for 20 years, and I'm going to tell you, there's not one cup of tea or an herb that will cure cancer. Okay? So all the people that I have seen during those 20 years, they tried things, and when they came back and they paid a lot of money to get cured, it was too late. So those 2 pieces of information I never forgot. And I thought they were like a message of the universe. At the end of the day, nobody's God but God, or nobody knows what will happen, right? But science is science, and that's what happened to me. That's my experience. If you have anything to comment about that.
Well, and my answer to like the herbal stuff is that if it truly worked, a pharmaceutical company would have figured out how to make it into a drug compound, slap a trade name on it, and charge you $10,000 a month for it, because this is America.
What about integrative, like kind of integrative too?
Integrative medicine, you mean?
Yeah, integrative, yeah.
Yeah, it's funny. So I'm being a female, I'm also a DO, a doctor of osteopathy, which is like it's essentially the same as an MD, but I think people's perception is I'm going to be more into like integrative medicine as a result of it. To be honest, it's just not my training. My training is traditional, like allopathic medicine, and that's all I can comment on. I don't want to ever come across as adversarial with alternative medicines. I encourage patients do both. Like if you do my thing and that thing. And if your outcomes are great, you can credit the integrative medicine. Like I'm not competing for credit here. I just want to get you cured. The only place you have to be a little careful is if you're taking substances that are not regulated by the FDA. I don't have a great way to assess drug interactions. Like they could interact with my drugs in a way I don't know. But in real life, it's very rarely a problem. Like every once in a while, I'll have a patient on a drug and then their liver enzymes jump up and they're taking something else. And I'm like, I need you to stop it now, because I can't tell if it's my drug or your drug. But, I don't get real confrontational or adversarial about it. If people want that to be part of their experience, whatever brings you peace.
Whatever it is, right? What about community, family, friends, bills? You have to pay, little kids. How do you deal with it? Because, you have to go through treatment. It impacts your life, right? And then, like you're very emotional about it. Some people don't know how to support you. Some people disappear from your life. There are the community groups. You have a lot of anger, anxiety, sorrow, all of this mixed together as a cocktail. What can you say? What kind of help can we get? What are the do's and the don'ts? How can we be supportive to those people that have it? And I want to say something else. When people say my cancer, don't say that, because it's not your flu or your cold or your measles. It's an illness, right? When you embrace it, you make it as it's part of you. And that's something I want to throw there to the mix.
Well, I think how can you support a friend going through it? If you're like, what are your skills? Like, for instance, if you have a medical background and you have a friend dealing with a cancer diagnosis, like if they're comfortable with it, you can offer to go to the visit with them to be the note taker. Because like I said, when my mom heard she needed chemo, like she was mentally out of that room. I was like shocked because she's pretty rational too. So like I just, I was there to write things down, to help her keep track of her meds, to just be that informational support, the record keeper, to help her remember things. So you can be that friend. You can, for instance, I actually play ice hockey, and there's about 15 girls on my team, and 3 so far have had breast cancer. And this one of my friends on the team just had it within the past year, and we pulled our money and we bought like an $800 gift certificate for this place locally that like cooks meals that you can pick up. So it's not like exactly catering, but you can order ahead of time, so that she had meals, even if she didn't feel like eating. She had 2 kids, just to make sure she didn't have to cook too much for her family. You can, like, another example is a lot of women are using these cold caps to help not lose their hair during chemo. They just got insurance coverage for it in New York, but in Pennsylvania, it's an out-of-pocket cost. So you could start a GoFundMe site for your friend. People are embarrassed to do that for themselves, but start a GoFundMe site to help raise the funds for that, or to help with any medical bills they're facing.
I would say ask what they need, or just see what they need and do it. And sometimes you just need company, or you just need, like this support of friendship, of love. Ask that, don't run away, please, because some people run away and because they cannot deal with it. But it's pretty sad, because tomorrow it can happen to you or somebody else. Something else can happen. Something will happen to all of us.
Well, and another thing too is most cancer centers have social workers and navigators. Ask your social worker what they can do for you. Like, for example, especially with breast cancer, there are there's different groups that will pay a month of your rent. They will send people to clean your house for free. If you can't afford your power bill, I sign stuff all day, every day saying you cannot shut the power off even though they haven't paid the bill, because their health will be at jeopardy, you know? So ask your social worker, like, medical bills are a huge source of financial stress, but people want to be philanthropic. Most hospitals have like a patient assistance fund to help patients with these extra expenses. So just don't be afraid to ask for help, because in our medical system, with the amount of medical bills that we incur here when something like this happens, or if you're out of work as a result of it, nobody can survive that without help. So just ask for help. We all need help.
Yeah, ask. We're human beings, so that's good. Ask. Just ask, right? There's a way always. Okay. You mentioned cold caps.
Mm-hmm.
Can you elaborate a little bit about cold caps and how can people get it? Are they work all the time? For me, it worked, right? But I was lucky. I only lost like 10% of my hair. I was thinning. I mean, I know it seems like something that is really kind of vain, but it's not. As a woman, our hair is important, how we look. We go through this and suddenly we lose our hair, right?
Mm-hmm.
And it's not a main thing. It's so important when we're going through that. It's another thing. And sometimes you focus more on that in your life because you want to
Mm-hmm.
look good, especially if you have little kids.
Well, and you know what? It just sucks to look different, because when you lose your hair, you look like a cancer patient. And boy, people cannot keep their mouth shut. Like, you will never get more unsolicited advice in your life, except when you're pregnant, of what you should be doing, like how you should be taking pureed asparagus instead of the chemo. So when you look different, people just feel free to comment. So it's nice to look like you're not getting cancer treatment. But the cold caps, I don't want to endorse a specific product. We use a specific company for it. It's like a machine you hook up to with a special cap. Some people use like these frozen caps, and I think it's like liquid nitrogen. It's really, really, really cold, and they bring it in a cooler. So there's all different ways to do it. What really depends on the success of it is the chemo regimen you're getting. So most breast cancer patients have heard of the Red Devil. It's a chemotherapy called adriamycin. And it's just red in the bag. If you have a regimen with that drug in it, it doesn't work very well. It's patchy, you'll lose a lot of hair, and it's expensive, and it's not worth the discomfort of the cold and the expense. But if you're getting a chemo regimen that does not have that drug in it, the outcomes are pretty good. You'll lose some hair, you'll shed some, but it takes the edge off of it growing back in for sure. And you don't have to feel bad about not wanting to lose your hair. Losing your hair sucks, because you might be losing your breasts too. And it's like an all-out assault, and maybe your ovaries. So it's an all-out assault on your womanhood, and it's okay to not like that and be mad about it.
Yeah. Thank you, because it's so true. Now let's go to part 3. We're going to take a little break here. We're going to go part 3 because it's been very long, but we have so much information. This is the last part of our show.